Welcome to the Ask Dr. Mozersky show for November, and this month we're going to talk about Botox and fillers. So, since we are talking about Botox and filler this month, we thought we'd actually do it with a patient here who's agreed to have her treatments done live on Ask Dr. Mozersky. But let's start with the biggest question we get, Doctor. What is Botox, and why would I want it in my face?
Well, Botox is actually a material that's made from a bacteria, and it's a local temporary muscle paralyzing agent. And the reason we put it in your face is because your facial expressions are controlled by the muscles of facial expression, which are numerous. There's over 60 of them in your face. So if you look sad or depressed or down or unhappy, it's because some muscle is making you look that way. So if we can figure out which ones make you look young and which ones make you look old, we can give the ones that make you look young a little bit of an advantage by inhibiting the ones that make you look old. So that's why we use it.
Very good. Okay, before you start on Jennifer, what areas specifically of the face does Botox best affect?
Well, usually Botox is most effective in the upper face, from the eyes up. And that's a very expressive part of the face. But in specific circumstances, it can be used in other parts of the face and even in the neck as well.
Okay. Well, you know, we always take pictures here at Contour Lace so the patients can see the before and after. I think before we start, we should have Jennifer sit up and show us her angry frown, because that will be something we'll want to look at later and see how good it is. How about that, Jennifer?
That's a great idea.
That sounds good. Let's see my angry face.
Oh, that'll be gone soon. Thanks, Jennifer. Just wonder, how long will it take for Jennifer to see these results?
These should start manifesting themselves in 3 to 5 days. Usually by that time, you can see the effect of the material.
Wonderful. And how long will it last? Will Botox last?
Generally last anywhere from 3.5 to 4 months.
Okay, great. So if you want to show us where you're going to do that, and we'll kind of see what the syringes look like with the Botox, and we'll get started on her.
Okay, well, one of Jennifer's problems is that she has a little frown here that she can make, and it's starting to cause some wrinkles in this area. And also, smile, Jennifer. There's some lines in the corner of her eyes when she tries to look happy. And then the other problem is that that as time has gone by, the gravitational forces have pulled her eyebrows down, so she doesn't look enthusiastic and excited. So what we want to try and do is put some Botox in this area here, so that that we can give her just a little bit of an eye lift like that, which that few millimeters makes a big difference in terms of how you look.
Great. So let's see it being done. I bet a lot of people that have wondered about Botox will like
All
this.
right, well, let's do it.
Getting ready there. I know we've both read some articles recently on the study of moods and how it increases happiness in people after they use Botox. I don't know about you, but just losing the wrinkles can make all of us feel pretty happy, huh?
Well, it's an interesting thing, because usually we think of the way we look as being the effect of what's making us happy or not. But the point of that article that you're referring to was that just having some Botox can actually make you feel happier. And I'm not sure really whether the happiness comes from the way people relate to you in a different way. If you look happy and open, whether they come on to you as being happier and more open to see you. So that's the issue. So turn over this way and scrunch your eyes really tight. Good. Open them up now. Open.
So we're starting with the crow's feet, right?
Right.
How's that feel, Jennifer?
Very, like hardly anything. I mean, it's so
Look
tiny.
over this way now. I'm going to do the same thing on this eye. Open. Okay. And now make a frown for me. A frown.
Oh, a frown.
Yeah.
Your anger, your anger
Your
marks.
forehead together. That's it. We're going to give her 10. All right, 5 units up. And 5 units down. And then we're going to put some in here. So now, look up at the roof and look at your hair and make your forehead wrinkle up totally. Okay? Go ahead and take some of those lines out of your forehead.
And I know a lot of people worry about not being able to show any expression at all, but I know here at Contour Lays, your patients are always happy because they lose a lot of the wrinkles, but you always make sure they still are able to have expression.
Right, that's all in the technique that we use, and we do want Jennifer, if she's happy, to be able to convey that feeling to other people, but we don't want her to convey a grumpy look, especially if she isn't grumpy.
There you go. So now that you're kind of finished with that, let me ask you a question. We've had several patients ask about BRO-tox. What is BRO-tox?
Well, BRO-tox is like a modern slang expression that refers to giving Botox to the brothers, to the men.
Oh, the bros.
So, and we do have quite a few men in different walks of life, everything from ranch foreman to hairdresser, and they come in here regularly for treatment. And male looks and cosmetic products even is the largest growing segment of that industry. So I think that's going to be a trend that continues this time as well.
Makes sense. Makes very much sense. Okay, now I know you want to do some filler using Juvederm on Jennifer, and tell us a little bit about where you do the filler on the face.
Well, in Jennifer's case, I think we're going to put it in her cheeks, right?
Yes.
So the reason we're going to do that is that as we get older, even though Jennifer has a full face, we lose the volume of this little apple in our cheeks. And as that happens, the force of gravity, if you sit up and swing your legs over that way, Jennifer, go to the camera, and the point, the force of gravity pulls this area down, and this line here becomes more and more pronounced. So what we want to try and do is restore this cheek up here so that she gets rid of this little faint line that's starting to develop and gives her just a little bit of a cheek lift. So let me have that marking pen. And I'm going to step in front of the camera while I do this. Look right at my nose. So those are the spots where we're going to put this.
So Dr. Mozersky, how long does it take for filler results to show up?
You can see usually right away. There's sometimes a little irritation from the process of putting it in, but I think we'll see some difference pretty quick.
And does
Okay,
it
so
last
Jennifer,
the same amount of time?
Oh no, filler lasts longer. It lasts anywhere from 8 months to 2 years. So reach up here with this left hand and hold this ice cube right there. And reach up here with your right hand and hold that one right there. This material has a little local anesthetic in it, so it's generally not painful. An ice cube is all we need to make it very comfortable. I'm going to take that off now. Alright, so now we're going to just put some down in the deep part of Jennifer's cheek to replace the buttress of fat that she's lost over her young life.
Jennifer, how does that one feel?
The same, very minimal, like a little mosquito sting.
Okay, so that's one cheek done.
Is there any downtime, Dr. Mozersky, after this procedure?
I think Jennifer can go out and party tonight. Sit up and let's see. You see, she already looks like her cheeks are fuller. She has a more youthful look in through this area. And when the Botox kicks in 3 to 5 days, I think Jennifer's going to look like a new woman.
Oh, I like that.
Okay.
What's wrong with the old one, Jennifer?
Great. Okay, well, one last question that everybody asks is this a cost-effective way to deal with wrinkles and volume loss?
I don't know if it's cost effective. I mean, this material is expensive, but it is certainly an easy way to do it. And so, if we could do something that was permanent and reliably would last for the rest of the patient's life, that would really be very cost effective. But the only way to do that is surgically. So it's not a bank breaker, but it is definitely an investment. But since our looks and our face and our appearance and the way we present to other people is extremely important, especially if you're out working in the world, then this is probably cost effective.
Very good way. Well, and that leads us to, once again, I think I mentioned at the beginning, November is Botox and Filler month at Contour Lays. So we're making it a little less painful on the pocketbook this month as everyone gets ready for the holidays. So if you want to find out about our deals and specials for Botox and Filler at Contour Lays, visit us at contourlays.com. Exclusive offers, and you can find out what we've got going on and schedule your appointment with Dr. Mozersky. As you can see, Jennifer handled it quite well. You can also call us at 210-494-8446. So join us next month for Ask Dr. Mozersky in December for the holiday season. But that's it for now in the November Ask Dr. Mozersky show.